morning. Halford House Centre, can I help?
I've never passed something as big as that. Well, it was on my toilet paper. It's got a little head on with a bit of prongs on, like that.
If he's got his earphones on,
yeah,
it makes it worse.
OK.
Lara.
If you get chest pain like that again, it's really important that you call an ambulance, because it could be a heart attack and that could be fatal.
When we know about people's food sticking, we worry about it being a cancer.
Yeah.
It's a background thing that's always there.
That's not very nice,
It's
is it,
horrible.
really?
It's just scary to think that it might be like this forever.
Morning.
All right, you okay?
Yeah.
Good.
Stephen Cutler. Hello. Hello.
Thank you.
Come and have a seat.
I've got like a sort of tremor
Yeah.
in my left arm
Yeah.
that I've had for years.
Yeah.
And it started seemingly getting a bit worse. So I just went out for food the other day, and when I was sort of trying to eat, it's a little bit now. When I was trying to eat, it was really starting to shake quite a bit.
Okay.
Sometimes, like, it's absolutely fine.
Yep.
But other times, I can't really put my finger on what it is that makes it happen. I think it might be possibly tiredness, maybe.
So you're 29 now. When did you first notice it?
I generally think I've had it for quite a few years.
Yeah.
I think, but it was so minor, I never really thought anything of it. But I think it's getting a bit worse.
You think it's a little bit worse? And what sort of work do you do?
I'm a physio.
OK, OK. So what do you think?
Yeah, I know. So I'm trying to diagnose it myself, yeah.
Yeah.
One of the reasons I'm getting it checked is my mum's got MS.
Right.
I've got no other symptoms, but I just thought
Yes.
probably worth flagging it up.
Yes. Do you want to just put your arms out like that for me? You have got this. It feels like you've got a fine tremor in both.
Yeah.
But it's more obvious on that side.
Come and have a seat. Right, now.
Today I went to school to pick her up early because she told her teacher that she has got pain in her private, and they were saying maybe it's a urine infection, so I brought like a urine sample here.
Very good.
Yeah, so...
But I saw you nearly 4 weeks ago with
I thought
tummy
it was
pain.
2 weeks ago. Yeah.
And you were feeling sick and the pain was in the middle here. Is this the same or is this something different?
Something different. So on the weekends, on Sunday it was starting to hurt, but on Monday it was like I was feeling more pain, and then on Tuesday when I went back to school it wasn't hurting, and then today it was starting to hurt.
Okay, yeah.
Well, let me check that and then we'll see. Have you noticed Kira weeing more often or getting up at night to go or anything like that?
No, actually she doesn't wake up at night to go to the toilet for wee. But she's been complaining about pain in her private. It's been 2 weeks now, so
yes.
I think she has got it.
Yeah, I think she has. Now have a look at this. You see that one there has gone really purple. That is a sign that you've probably got a water infection.
Yeah, water infection is my third.
Any pain anywhere else?
No, just only this part.
Do you want to just lie on my couch for a minute? Let me just feel your tummy.
Okay.
How old are you now?
9.
9.
Yeah,
OK. Show me where the pain is, can you?
this part.
Oh, it's right down there in the poor old... OK. Poor you. Up you get. Well, at least we know what the diagnosis is, probably. You need to take 2 teaspoonfuls 3 times a day.
Okay.
We'll send that to the laboratory and that'll tell us if it definitely is an infection. And then the other thing is they'll look and make sure that this is the right treatment, the right antibiotic. So that's exactly what you had last time.
You have to take this to school.
Take this.
No, the
Okay.
Everything okay?
And then if all your symptoms don't get completely better, we should see you again next week.
Okay.
Well, you'll feel much better in a minute as soon as you've had some treatment. Is that all right?
Yes.
OK,
Thank
and it's a pleasure to have you.
Thank you. Have
All
a
right.
good day.
Bye-bye.
Bye.
This is what it is always like.
Yeah.
But sometimes it really... The other day I was trying to eat some food and it was really like that. And I had to
Yes.
sort of put this hand down and
Yes.
it's really noticeable. I do have a shoulder problem on the left side, is the only thing.
Right. The other things in my head of tremor can be from thyroid disorder. We should probably do some bloods and just check that.
Okay.
Can I get you to just do me one or two little things just to look at the cerebellar function? So hand like this. Okay, and now a bit faster. Okay, and then let's do it the other way around. So that hand down that one. Okay. Great. Okay. Next thing I want you to do is to touch your nose and touch my finger. Touch your nose, touch my finger.
Just I can feel it shaking a bit when I do that. Yeah, that's bringing it on in there.
Okay.
It's like a sort of juddery.
Yeah. Okay. So that does seem to sort of exaggerate it.
Yeah.
Okay. Let's see you do that with that one.
I'd say very slightly, but yeah, doesn't seem.
Okay. Okay.
That definitely probably that's what it feels like.
That's what it feels
when
like.
goes,
Okay.
yeah.
Okay. And you don't experience that in your legs.
No, not that I've ever
at all?
noticed.
Your main worry is around MS.
I wouldn't even say worry, to be
No.
honest. There's just slightly increased chances.
Yeah.
I thought I'd bring it up. So
Yeah.
there's-
Yeah.
yeah. So if anything happens in the future, we can sort of say, right, okay, well, it started then.
So if we get some bloods done, and then to think about whether we want to ask neurology to see you just to check it out, do you think that you would favour that?
Yeah, that sounds like a plan.
Okay. Then why didn't I just do both those things? And then, as you say, it'll sort of lay it to rest, won't it?
Yeah.
Great.
Will do.
Okay.
All right.
Great.
Thank you very
Nice to
much.
meet you.
See you.
Bye then.
No, where you are is a practice. It's a doctor's practice.
All right. It doesn't mean she's going to practice on you. All right, you take care then. Thank you. Bye-bye.
Alan Place. Morning.
Hiya.
Come on in.
Hiya. Well, about 1 month ago, I think I came very close to a heart attack.
All right.
It was as though somebody was hitting me in the chest for about an hour.
Mm-hmm.
I had to sit down for an hour, and after that, I was still shaky for about 2 hours.
Oh, gosh.
And I suppose you heard about the fire.
I haven't really heard about the fire. What?
Well, our next-door neighbours decided to have a burning session next to a wooden fence. And an ember caught on our shed. Our side of the house caught the entire flame because the wind was coming that way.
Gosh.
We had 80-foot flames and 2 tenders. We lost nearly everything.
Just a little listen to your heart.
Breathe away, mouth open. I was watching the television and all of a sudden I realised that my heart was beating really fast.
I've been having this palpitation. I'm waking at night time as well and having like, oh.
What is?
A stethoscope. You can hear my heart. How does my heart sound?
Excellent.
I had a heart attack 26 years ago.
26 years ago?
Well, you've survived that, haven't you?
That's amazing.
No wonder the Victorians died of heart attacks with all them stairs and no lifts.
And I suppose you heard about the fire. We lost 2 cats.
Oh, how horrible. What about the rest of the family? Was everybody all right then?
Well, fortunately, most of the other kids were out.
How terrifying.
Yeah, it was. I mean, there was just nothing left.
Yeah. How are you feeling about everything?
Well, I'm still shaky.
I'm not surprised.
I mean, I've lost about 1.5 stone.
Can we help from a health point of view with anything in the aftermath after that?
Well, Lynn and I both need full prescriptions, please.
OK, I'll give you some more medicine. When you say that you were worried that you'd had a heart attack, what was the pain like?
Well, it was like somebody just hit me in the chest with a fist.
And then it stayed for a couple of hours, and then it went away?
Yeah.
Do you get angina regularly when you walk?
I get the odd one if I walk a bit too fast. But...
OK, but this was a permanent chest pain that was there all the time. Because you had an echo.
Yeah.
And they said that that all looked normal. I guess one of the challenges here is if it happened a while ago and it's not happened since, what do we do about that? It's probably worth us repeating your ECG and the blood test just to double check, because if it was positive, it would change what we did.
Yeah.
But otherwise, I wouldn't want to say what had happened at that point with certainty. Yeah. What I would say, though, is if you get chest pain like that again, it's really important that you call an ambulance, because it could be a heart attack, and that might be something really serious. Obviously, that could be fatal if you had an ongoing heart attack that you didn't do anything about. Let's have a look, then. Well, blood pressure's lovely and normal today. Just listen in here. Your oxygen level is OK, and the pulse is OK, and everything else seems normal.
Right.
And then I'll see you in a couple of weeks to follow up.
Right, lovely.
All right.
Thank you very much.
Bye, then.
Bye.
Have a seat. Well, like your top.
Thank you.
How are you?
Oh, I think I got the dreaded lurgy.
Right.
I've come in basically. I've got a couple of things going on. I've had this cough for about 2 weeks.
Right.
Ago, and it's all in the nose as well.
Right.
And then also I've got this. I think it's MRSA. I'm not sure. It's done with Dr. Roberts a long time ago, and it's still up my nose, but it won't go. It's not gone yet. I had the cream, but it's still not gone.
First of all, the cough.
Yeah.
Yep.
It's really,
So you've had it for
really
2
painful.
weeks. Are you coughing anything up?
Yeah, greeny.
Right. And when you say it's painful, where?
It just hurts the rib cage when I cough.
Right.
It's nothing like major. It's
Yeah.
just
Any temperatures or anything like that?
getting the hot and cold sweats,
Okay.
but nothing.
Let's have a little look. Just check your temperature. And your hair. That's cool.
Oh, I think it's a midlife crisis, to be honest with you.
Why not?
Sorry.
Let's have a little listen. Deep breaths. And out. I'll just tap on it. Yeah, I think there's a bit of a sign of infection on the right lower chest. So I think it's worth trying. Bless you. You all right? So I think it's worth trying some antibiotics. So amoxicillin 1-3 times a day for a week.
OK.
If it's not getting better or gets worse, come back and see us.
No problem.
Right, tell me about the nose.
Oh, my goodness. It's been going on for a long time. When you're blowing your nose and you get sore up there, good old rub in try and sneeze, and it does bleed. But it's really painful at this side up here. And Dr. Roberts a long time ago took a swab. I think it came back positive.
MRSA is a very common bacteria found on the skin of 1 in 30 people. In healthy people, it causes no symptoms at all and is absolutely nothing to worry about. However, in some people, that bacteria is resistant to antibiotics, and it's this resistance that people worry about, because if they develop an infection, then it's very difficult to treat. And that's where we've heard of the term superbugs, and people get quite worried about it. I mean, we're all going to have bacteria up our noses.
Yeah. They're just falling apart now. Get to a certain age, you see, you start declining, don't you? It's probably not that clear, actually.
Little bit of redness, nothing massive.
Good.
Shall I just give you some sort of antiseptic cream to try on it?
Yeah, anything, really?
Oh, yeah. Right. So, antibiotics for the chest and the nasal cream.
Brilliant.
OK?
Thank you very much.
No problem. Nice to see you.
Yeah, you too. Take care.
Bye-bye.
Hiya.
Hi, so sorry I'm late.
Come on in.
Yes. Over the last couple of months, he started shaking his head like that.
OK.
And it's getting worse and worse. He doesn't even know that he's doing it. If I say stop shaking your head, no, you don't.
What do you think is going on with it?
I don't know. It's
No. Is this what it is?
No, he's doing that on purpose.
OK, when's it happening then?
Well, do you know what? If he's got his earphones on,
yeah,
it makes it worse.
OK.
Laura.
It does make it worse. And when I tell him to stop, he'll do it on purpose.
OK.
But
And what's
Other than
worrying
that,
you about
he
it?
doesn't know what it is.
No.
Because I don't know what it is.
So you don't know what it is?
I mean, I don't know whether it's something major or whether it's something
Yeah,
not.
because I know that he's under the community paediatrician.
Yeah.
And he's not blacking out or having anything else going on.
No, but when he was a baby, he had a massive convulsion fit.
Okay.
And he nearly passed, but he was blue.
And is it affecting him in any way?
No, but it's just strange that he's
Just
doing
strange.
it.
Have you got a video of it?
No.
Okay. Because from what you're describing, any little sudden movements like this are probably tics. Have you heard of those?
Yeah.
Before? Come over here and let's have a look then.
That's it. Thank you very much, son.
Well done.
That tickles.
It tickles.
Good boy.
Just look in the back of your eyes.
I've taken him to the optician.
Yeah, and they were happy, were they?
Yeah, they said his eyes are perfect.
And is he smacking his lips or his tongue or saying anything?
No.
No. Open your eyes really wide, close them really tight. Show me your teeth, blow your cheeks out, give me a cough. Shrug your shoulders, stick your tongue out, left and right. Stand on tiptoes for me. Stand on your heels. That's all great, have a seat. So I think that most likely these are tics, and it's a relatively common condition where kids just move their heads out of habit. I'll write down the name of it for you to go and have a read up about it. There isn't a magic treatment to make them go away, sadly.
No, I just didn't
It's
know
about
whether it
recognising
was
that
something
it's a common-
serious and...
No, it's not a serious problem. It just can be an annoying one.
He doesn't actually know he's doing it when he's doing it.
No.
And only when I tell you. Quite often now.
Yeah. So if you can get some video and then come back just for general follow-up, and then we'll wait and see what happens when you go and see the community paediatricians to follow up for everything else.
OK, thank you.
All right?
Yep.
And,
Thank you very much.
OK.
Okay,
Nice to see you. Bye
nice
then.
to see you. Come on then, guys.
All it is, I can't stand the heat, not this oppressive heat.
No, I don't like this either.
Oh, and I thought, you can't come out in your summer clothes. It's a bit ridiculous.
It is, yeah, but then what do you do? I can't stand this rain.
The trouble is, it starts raining, it forgets to stop then,
Yeah.
doesn't it?
It's awful. Awful
Yeah.
weather.
Come and take a seat.
Thank you very much.
How can I help?
I kind of want to cut down on the citalopram because I feel so spaced out. Basically, I came off my tablets because I ran out and I just split them in half so they would last until I had my appointment.
OK.
And for the last day or two, I didn't have any left. And I get, like, a vertigo thing. And it's horrible.
Yes.
And now I'm like, I have to come off these things because it's shown me how, like, dependent I've become on them.
OK, maybe we should tackle the anxiety in a different way.
Yeah.
We could lower the dose because when you say this sort of spaced out feeling, it can take the edge off things a bit too much sometimes.
Yeah, I think
So-
that's what it's like. It was good when I needed it.
Yes.
But now, you know, I've changed jobs. I'm nowhere near stressed out as I
Good.
was before.
Good.
And I feel like a lot calmer and I feel more in control of my anxiety as well now.
Which is great.
Yeah.
So one option is that we reduce it, and in the background, I don't know if you managed to get any counselling or access what we call Bristol Wellbeing Therapies. You can self-refer.
Okay.
And longer term, because we're only, 27, you'll find that the anxiety at times is fine, and it might just be fine because you've changed jobs.
Yeah.
Or maybe doing a little bit of work on it, so...
I think that'd be really good because it's like, at the end of the day, even though I'm feeling better, I still have this constant worry that I'm going to flip back.
So
and
is
it's not like it's a background thing that is always there.
Yeah.
Like, every minute of every day.
So that's not very nice, is
It's
it,
horrible.
really? So actually, if we could make that better for you and have sort of strategies in place so that it's tackled well.
Yeah.
Because I can see you're getting emotional about it,
Yeah.
you know, and longer term, that would serve you really well.
It's just scary to think that it might be like this forever.
Yeah, you won't. Once you're armed with certain things to help you, it will serve you well all your life. What dose are you taking at the moment?
40.
Then? So what I'm thinking is that we reduce it to 30 milligrams
Yeah.
for a couple of weeks.
Yeah.
And then reduce it
to 20.
Yeah.
And things okay at home? Things okay with your relationship?
Yeah, really good.
Because you've been together for how long, remind me?
Like 3.5 years.
Yeah, so that's good.
Yeah, we've moved in together.
Okay, good.
And he's bought me a cat.
Right, okay. That's therapeutic as well, you know.
Honestly, it's worked a dream.
Well, that's fantastic.
It's so calming.
You might have to have some in the waiting room.
Yeah.
So have a look at this. Okay, Harriet.
Thank you very much.
And I'll touch base with you within 4 to 6 weeks.
Okay.
All right.
Thank you so much.
That's all right, good.
Thank you. Have a nice day.
You too. Take
Thanks,
care. Glad the job's
bye.
better.
Oh, thank you.
Bye.
Bye.
Oh, we've got a baddie thumb. What have you done?
Hamster.
Hamster bit. Your hamster? No, that's a naughty hamster, isn't it?
Those cats stand on him.
What'd she say?
She wants Daddy to stand on her.
Oh no, I'm not so sure about standing on him. Perhaps we can tell him off.
Okay, so she's got a problem with eating, or
Just eating.
just eating. Okay, it actually comes back. She actually vomits.
She just throws up.
Throws it up. How long has this been going on for?
Maybe 4 or 5 months.
This is quite a worrying symptom, so we need to really think carefully about what we're going to do. Okay. Is it causing pain?
Do care for that? No.
There's no pain, there's no... Do you know what I mean by indigestion symptoms? Does she get those?
No.
Nothing?
Nothing like that.
I think I'm going to need to get her up on the couch, okay? If I can work out this bed, I'm going to lower it. Oh, look at this. This is magic, though. I haven't got a fancy bed like this. That's good for her. So I want her to lie down. Yeah, okay. Okay. What I want to do is just feel your tummy, okay? Any pain now? No? Lovely. Okay, right, we'll get her up again. You want to just come and...
Yeah.
I'm just having a quick look because about 10, 12 years ago, we found that she had this thing called a hiatus hernia.
Okay.
Yeah? Do you remember? In 2005, I wrote, intermittent difficulty swallowing solids, food sticks, she brings it up.
Yeah.
Okay?
Yeah.
Exactly the same now.
symptom,
What happened then was I did an urgent referral and she had that endoscopy.
That's right.
Okay?
Yeah.
That is an option today, all right? I'm not sure how much she would want that.
Right.
What happened then was she had this bug in her tummy, I don't know if you remember, and she had antibiotics, and she also was then given other medicines, and she actually gained weight and it all settled down. Okay, so there's two possibilities. This is the same problem, come back again, in which case we could do that test for that bug again and then give her that treatment if it was positive and see what happens, okay? The risk with that is that when we know about people's food sticking stuff, we worry about it being a cancer.
Yeah.
Okay?
Come on, darling. Right.
Do you want a hand? Take your time, take your time. I'll just help you onto this.
Do you think you could hold him just for a sec?
Do you want me to help you move it up?
Yeah, moving it is not a problem.
Okay.
Her knee is swollen.
Thank you.
Thank you, Dr. It's quite all right.
Do you want a hand?
Yeah. Can you just pull it that way from me?
Yeah.
Oh, Jesus, wow.
There we are.
Thank you.
The only way I would know it was a cancer would be to get that endoscopy thing again.
Okay.
Okay? Yeah. I can do that, but she is very frail, and we've had lots of conversations about she doesn't really want tests and things. Would you like to just have a little talk with her?
Okay. I will explain to her.
Yeah, OK, you have a little chat and I'll go and do what I need to do, OK?
Toilet name she doesn't want that.
That test. OK. Have you...
I
Okay.
explained that to properly.
You've used the word cancer, yeah?
I did. I said I can use it again. I said the possibility of cancer, but
yeah. I don't think that is unreasonable, okay? Because of what happened before, In that case, then, I'll keep an eye on her, and we can always have that conversation again. And if she changes her mind at any point, you can just phone me, OK? So the first thing we need, then, is a poo sample. Today, if possible, otherwise Monday, OK? I will be giving her some tablets, but I need to wait for this result to decide which tablets to give her. Is that OK? All right.
I'll try to bring it today, otherwise Monday, yeah?
Wonderful. Yes, and then keep in touch with me. Let me know what's going on. We can speak to make sure we got the right prescription organised, but then I should probably see her in about a month or so.
Okay. Shall I make an appointment after a month?
Yeah, yeah. OK?
Thank you.
She got any questions?
Okay, question, which one? No, this is okay.
OK, all right, thank you very much. OK, bye-bye.
Bye.
Bye. Bye.
They look comfy, those shoes, Sally.
Do you know, I got them out of the wardrobe this morning, I bought them, and I found this skirt in the wardrobe. I thought, that actually will go. And they're really lovely.
But as long as you get, like, wedges, they are really comfy.
Morning.
Morning.
How are you doing?
I'm fine, thank you very much.
Because I know that, you know, with all the stuff with your cancer and the difficulty swallowing
It's improving. I still have difficulty. But you try, you know?
Yeah. Do you think it's getting better then?
It's going to be a long haul, Tom.
Sure.
We ain't at the steak and pizza stage yet, unfortunately.
David has had a cancerous tumour at the back of his mouth in his gum, and he's been under the hospital specialist for the last couple of years. He's needed an operation to remove this tumour, and unfortunately this has affected his sense of taste and his swallowing. And this was part of the reason that he came to see me. Are you able to enjoy your food in any way?
Not as much as I used to, not by any long stretch. And it's very frustrating.
I bet.
Because I exist on a soft diet, but, you know, you try.
Sure.
It's not going to beat me.
Well, that's the most important thing, and I'm glad to hear that. How much are you drinking at the moment? Is that...
Professor Thomas said I'm drinking half a bottle of vodka a day. Now, that's a slight exaggeration.
How much do you think you are drinking?
Well, quite considerably less.
Oh, good. Well, well done.
It's a variation on the drink that I used to drink in Spain, La Mumba, which is chocolate milk and brandy. But I've had some vodka, so I started off with vodka. It's just to take the sweetness away from the chocolate milk. Like, you have to dilute the chocolate milk. I can't take it neat. I'm not man enough.
No.
Right, what can I do for you?
I have something in my throat.
Right.
So it just feels really weird. The first time I felt it, I've had like a toffee sweet and there was a tiny little bit left and kind of, you know, when you've got something sort of stuck and I was driving, I kind of panicked because it's stuck in my throat. Yeah. And it stayed there for a while. I didn't think much of it. Obviously, eventually, it probably melted away. And then again, I was just having a piece of toast. Yeah. And it felt like, like I scratched it quite badly, and then I can just feel it ever since. And it's just constantly there. So it makes me think it's not really something stuck. It's more like there's... Sorry, I'm just turning...
Right, I'm glad it's not mine. I was thinking if I turn mine off, mine is turned off. Yeah, no, that's fine.
Yeah, and it's just constantly there. It's kind of annoying and a little bit worrying.
Sure. And what sort of time frame?
Well, the first one, probably about a month and a half.
Okay, yep. Are you otherwise fit and well?
Yeah.
No weight loss?
Not really.
And do you smoke? No. Do you drink much alcohol?
Not much, but yeah, I'll probably have a glass of wine every couple of days.
Okay.
So we all do.
Yes. Okay. And in terms of family history, anything significant?
My mum had ovarian cancer.
Right.
My mum had is it thyroid operation?
Yep. Okay. Can I have a little feel of your neck?
I mean, I kind of thought I felt a bit dizzy a few times, but I've been so tired.
So there's no lumps or anything?
Yeah, it's kind of round there.
Round there. I wonder if your thyroid gland is a little bit enlarged. Okay, let's have a little look at your throat. Sorry.
I've got my jaw kind of locks.
Ooh! Oh, gosh! Sorry. Great party trick.
It does sometimes.
Oh, dear. That looks fine. Just wash my hands. A bit unusual. I think we definitely need to look into this. probably an ear, nose and throat referral, to be honest, because I think they're going to have a little look down with the camera.
Yeah. A bit further down.
Yeah. I just wonder if I refer you for a scan as well as for your thyroid. And you're saying you're feeling quite tired?
Yeah.
And is your throat sore with it at all?
Now when I'm talking, I can feel sort of, I think there's something there sort of moving.
Right, OK. I'm going to refer you under what we call the 2-week wait then, which is to rule out anything nasty like a cancer. I think it's unlikely to be a cancer in your age, but we want to check it out for sure. So I'll refer you, you'll get an appointment in the post within 2 weeks. If you don't, please let me know. Let's check some bloods in the meantime, OK? And I'll refer you for a scan of the thyroid as well. Is that all right?
Thank you.
OK, all the best. No
Thanks
problem.
very much.
Bye-bye.
Cheers.
So how much vodka do you think you're getting through a week?
I reckon a bottle would probably last me at least 3 days.
OK. So that's a couple of bottles at least a week?
A week. Which is, for me, quite good.
Well, it may be for you good, although it's still quite a lot higher, as you know, than the recommended levels. And given your previous cancer and things like that, I know that you've been told this before, and it's important for me to tell you again that could be dangerous or damaging for your health.
Yeah, this is, I think, possibly part of the problem, because I don't think it's a problem.
We can offer support and help to stop if you wanted to.
Well, yeah.
And then ultimately, it's up to you, isn't it?
If I find
it's your choice about what you want to do.
It's getting on top of me, you know, you'll be the first port of call.
Well, good, I'm glad about that.
If I have previously been diagnosed as a dry alcoholic.
Right.
Do you know what that is?
No.
It's someone who gets their gratification from seeing people drink.
Right. I've not heard that phrase before.
No, neither have I. So if I need any gratification, I watch people in the pub.
Well, maybe that would be a way of just cutting down a bit. Buying lemon... OK, so...
Right, so I'm going to book in a blood for, I think, about 7.
Perfect.
And you've done the...
And I've sent the medicines all over, so there's a new batch that's all gone over to the chemist. Well, nice to see you, and I'll see you in a couple of months' time when we'll have the results of those tests.
Yeah, OK.
All right, nice to see you. Bye-bye.
Bye.
But I haven't seen a diabetic nurse for over 6 months.
Oh, better get you in.
Yeah, you better.
There'll be trouble otherwise.
So, Emma, have you got one of these already, or is this a...
Yeah, I've got one already. I found out that it was supposed to have been out in March.
Fine.
So I moved her a little bit.
So we really need to put it in your other arm now.
Right, OK.
Because nowadays they say to us after 2 we should switch to the other arm. So given that we know it ran out in March...
Yeah.
Have you...
I've done a pregnancy test first thing this morning.
OK.
And it was negative, so...
When did you last have sex?
About 4 days ago.
Using protection?
No.
I mean, I'm happy to replace it.
Yeah.
I can't be 100% sure that you're not pregnant, but from what you're saying to me, you don't want to be pregnant.
Oh, God, no.
No, then we need to get this one into you so that you've got good ongoing contraception again. But we should still do another pregnancy test in about 3 weeks' time to just be absolutely sure. What I want you to do is to use condoms for this next week if you have sex, just because it would take a week for a new one to work.
Right, yeah.
So...
Sorry.
Oh.
Sorry, it's phone off because it's going to do it again.
Is it going to do it again? OK.
Oh.
Lovely. OK, right. Do you want to come and hop yourself up on here? Pop that there. A little bit of cold and wet just on your arm to clean it. Sharp prick coming? No, fine. Get it in. And then we're just going to... Great, so that's that one in. That's great. OK. Just going to sort this trolley out, and then we'll start again on the other side. OK. You ready?
Yep.
Just feel it. That's fine. It's coming out nicely now. It did need a bit of a pull, didn't it? Yeah. That's out there now. Lovely. This dressing is to stay on for 2 days.
Yep.
And the bandage for 24 hours. Okay. Both arms.
Is that one done?
What have I told you about when you can rely on this? Can you remember?
No.
Okay, so don't rely on it until it's been in for 7 days. And then a pregnancy test?
4 weeks.
Perfect.
Thanks.
Bye.
Bye.
Welcome to your home. So kiss it back. Can we kiss it back?
Well, I'm very pleased to see that your lung function tests are okay, Sylvia.
That's brilliant, isn't it? Yeah.
You probably got a lecture about stopping smoking to stop problems in the future. But, you know, you are 74 now, so...
Am I that age, really? Sorry.
What I mean is that...
No. I know where you're coming from, you're right.
How many is it a day? How many cigarettes a day?
It's round about 20. Some days I do and some days.
So if we kept it, say, at 15...
I am trying now.
That would probably help. You could save about £3 a year, then you and Terry could go on a holiday and get some sunshine.
I know.
That would be better. But your chest X-ray, they said that there may be a little bit of infection at the bottom of the left base here. It's called atelectasis, which isn't quite infection. And what they said is to check your X-ray again in 6 weeks to see if that's got better.
But the other ongoing problem, there is still something in my toilet.
With the stool side of things, I think we've covered that a lot. That's been, your whole gut has been checked.
But I passed.
Your samples, everything.
But there is something attacking my system like a worm, and I think this could be...
Yeah, there's nothing attacking your system.
It's not imagination, because it's there in my toilet. You know, women wipe themselves, don't they? And they fold their paper. That's the only
So what,
reason
do you feel itchy down below? Do you feel you've seen any worms?
No.
No.
Yes, I do see something. It's got a little head on and with little prongs on, like that.
I feel strange. I've been weeing a lot this morning. I've had about 7 wees.
And you were getting some blood in the urine. Has that happened?
Not that I notice. I mean, I don't always piss in a loo.
Okay. I won't ask any further questions on it.
I'm going to Thailand in 4 weeks. I've been told I need to get some injections.
You haven't been to the toilet in 4 weeks, is that what you said?
No, sorry. I'm going to Thailand.
You're going to Thailand?
I have been to the toilet.
Sorry, misheard you there.
I've never passed something as big as that. Well, it was on my toilet paper. You know, if you say the size of a broad bean, that was the size what I've got home in the jar. But because it's in a little honey jar, it's now going furry.
Okay.
So I was going to bring it up to you, but it's too embarrassing to bring it up to you.
Okay.
But it's nothing I'm eating because I don't have broad beans, and I haven't had broad beans for a long time.
But the previous stool samples have also been checked and looked at, and they've been fine.
Well,
I
I
think
don't
what
know.
might be a better thing, we can do a stool sample, is that if you took a picture of what you're describing and bring them in to me next time.
Yeah.
You seem very focused on the gut always.
But would it be because I had an ulcerated stomach years ago? I didn't.
Yeah, no, not related to any of that.
No.
There's nothing parasitic or worm-like in your gut that's causing you a problem. Okay?
I'm afraid to turn around and say, because before, like with Dr. Drew, he'd put everything down as a mental issue, which isn't a mental issue.
Apart from sort of looking at the psychological aspect of it, we've also physically checked your gut.
Yeah.
Okay? If it happens again, you can get a stool sample pot from the treatment room, and we can check it once again and send it off as we have done. So for now, don't forget to go along for your chest X-ray that we talked about.
Oh, I will,
Yeah.
yeah.
And I'll see you back, and we'll go through the results of all of that. Is that okay?
Yeah, that's
All
fine.
right,
That's
good.
lovely.
All right? Good.
So you're finished with me now?
Yes.
You don't need me anymore.
No, that's all right. Thank you. Take care.
And you.
See you soon.
Bye.
Bye-bye.
It might be just going nutty as I'm getting older.
Why don't we talk about that? We'll talk about all your concerns, okay? Take care, Sylvia. Bye-bye.
Brilliant, that's really good. Yep, that sounds a lot better, actually.
I would say generally it is getting better.
Sure.
I definitely feel I'm on a bit of an upward swing.
It's good to hear.
Doc, I really want to get better.
And I think that you are getting better.
I think you're an inspiration, actually, of how well you've done.
I just try and keep myself busy.
Take a seat, hon. So, 2 days in Devon, so you look really well on it.
Yeah.
And how are you doing?
Really well.
Yeah. I would say watching you walk in, you looked really good.
Yeah, I've...
That's amazing.
I'm trying not to use a stick.
Yeah.
Which does hurt my hips, but I found I was going like that. I've been taking omega-3, 6 and 9 and multivitamins.
Brilliant.
I've been swimming or doing aquarobics 3 times a week.
You look a different person today. It's quite astonishing.
I've lost 10 pounds as well.
Amazing.
So I'm just trying to be positive now.
Nicola's got quite a complex past medical history. She suffered with Hodgkin's lymphoma back in 2014, which required treatment with 6 cycles of chemotherapy. And she did really well in terms of the response clinically to the chemotherapy from the Hodgkin's point of view and went into remission. But some months after she'd finished her chemo, she developed initially quite bad back pain, and that went on to become more chronic and more generalised. And over the last few years, she's developed a condition that we call fibromyalgia.
I'm still in a lot of pain, but what I find is when I get in the water, I just feel like me again. I just feel normal.
It's a bit like when I remember being pregnant, swimming. I love swimming in pregnancy.
I just love swimming.
But A, it's a lovely meditative thing to do,
Yeah.
and it's, well, not if you're surrounded by lots of kids in Europe, but, you know, it just removes gravity.
It's something I could do before, so...
Yeah. Oh, I'm really impressed.
Yeah, my son decided to go camping in Woolacombe.
Oh, fantastic. Well, would you have even contemplated to have gone camping a year ago?
I did struggle, but I loved every second of it. So I think mentally, I'm feeling a lot more positive.
But also, we know that exercise helps with pain. We know it. You know, over time, it helps remodulate
And
sort
I
of
know
pain receptors and
losing
things.
weight is bound to help.
Yeah.
So my big aim now is hopefully to get back to work by the end of the year.
Just remind me what you're doing, because I can't remember.
I'm a school cook.
Yeah, that's it. So it's really physical, isn't it?
Yeah.
Well, I'm really impressed. That's brilliant news.
I'm feeling good about myself as well. So
where are we with the medication?
right, with the medication, I'm taking 2 of the morphine a week, and I was wondering if I could stop them now.
Yeah, I think if you're down to 2 a week, you can. I know that was something you really wanted to do, wasn't it?
Yeah.
And then, so in terms of the pregabalin, what do you
Well,
want
I'm hoping I can up that a little bit.
Yeah. So you're now taking what dose? Is it 225?
225.
Twice a day.
Yeah.
So I guess, and again, I mean, some doctors would ramp it up quite dramatically. I prefer not to. I mean, it depends on what you want to do. 'cause
No,
I
I'd
think
rather do it bit by bit because it also encourages weight gain, and I'm really trying hard to lose weight now.
Exactly.
So
That's a really good
little
point.
bit at a time would be.
Well, I guess the logical thing would be go up by another 75.
Right. Okay. Well, thank you very much.
Wonderful to have met you.
Yeah, and you. Thank you.
You've
been amazing.
Well, you're doing amazingly.
We're doing amazingly
Yeah,
between us.
good team. Okay,
All right,
Millie. All the
thanks
best,
a lot.
Nicola. I wish you all the best. Take care, Millie. Bye.
So bye-bye. Bye. Bye-bye.
OK.
Thank you very much.
That's a pleasure.
So say thank you very much.
Thank you.
I don't know what to do. I don't want it spreading and spreading.
I would say that means there are some issues with your memory.
It's fed up with just being in pain all the time. It's just getting to the point where it's just... I'm so sorry.
That's all right.